Now, I want to show some office-based surgeries, just very briefly. We do some procedures in the office. We have sterile instruments and lots of betadine and sterile drapes, and we have a monitor, etc. for shorter procedures. And for the person who wants either to avoid a general anesthetic at the surgery center or hospital, or just prefers to be relaxed and semi-awake. So people come into the office and they get oral sedation pills, oral narcotic, oral antibiotic, and usually something like a Benadryl. They get very mellow. Then I numb up the skin. That stings because it's a needle, but we let it soak in. And then I numb up the deeper tissues, and so then they end up mellow, numb, but they're awake. The surgery center or hospital, they start an IV. They give you those same medicines right in the vein. Sedative, narcotic, and an antibiotic, and you just tell the anesthesiologist how deep you want to go. I want to take a nap, I want to have a heavy general, light general, just sedation, just twilight. So then I numb you up anyway and do a procedure. So custom designed approach, and I do lots here in the office. I do lots at the surgery center downstairs or on Cass Street. I do lots at the hospital. I'm the chief of the division at the hospital. Custom designed approach. So what about, so I'm going to go back to I showed the thirds, top third, middle third, lower third, brow lift. Here's a gal who's good looking, but her brows gave her this sort of tired appearance, and to make mini incisions to pick up the brows can make a very dramatic difference. I'm typically very conservative with men, but there still are some men that can benefit from a conservative brow lift. So here's a guy with really good looking blue eyes, and just a conservative brow lift can be very powerful. Can affect a person's appearance and make them feel better. Now, something very important about adjacent structures. Whenever I look at the eyelid and eyebrow, we need to look at the adjacent structures. In other words, when I look at the upper eyelid, the eyebrow is the roof of the upper lid. When I look at the lower eyelid, we know that the upper cheek is the foundation. So sometimes people come in and they say, I just want my upper lids done or my lower lids done. Oftentimes we can do that, but we need to at least look at the adjacent structures because people need to be educated about how they present. So here's a gal who was concerned about her tired eyes, and what I did was a conservative upper eyelid blepharoplasty, like an eyelid tuck, and I also lifted the corner of her brow through an incision up in the hair, and I also just barely lifted the malar area, the cheekbone. It's a really important part of appearance. And I think she looks natural, she looks more vibrant, she looks more awake. Now, what about mini lifts? Limited incision facial lifts. Every client deserves a custom designed approach. When I'm trying to remove lots of skin or reposition lots of skin, the only way I know how to do that is to make a longer incision. When I make an incision just to get access, then it can be much shorter. Most people knew that 30, 40 years ago, if you had a bad gallbladder, you had an incision about this long, and one surgeon or two surgeons put all their hands in there and worked, and then you got sewn up, right? And you had railroad tracks and caterpillar marks, and it was kind of like your badge of honor that you had an incision that long. Now, if you get a bad gallbladder, you're likely to have laparoscopic surgery, where incisions are made about like this. Same for the knee. The little telescopes, little laparoscopes are put in, and one surgeon or assistant can look at the TV screen and manipulate like that. Same thing in plastic surgery. We are trying to do more with shorter incisions. Trying. So, for example, here's a gal who came in and said to me that she noted the early changes in her neck. She didn't feel like she was ready for a big neck lift, and she's not. So a short incision underneath the chin and a shorter incision around the ears can result in that. Here's a gal that we really wouldn't recommend a full facelift for, but she did want a little bit of lift in her neck and jowl area. Shorter incision gives her that. So, custom designed approach. Here's a gal who came to me and said she wanted fillers in these lines here. I said, you know, by the time we use up all those syringes of fillers, it's probably going to cost you more, and it's going to not last as long as a mini lift. So let's do a mini lift. Short incisions around the ears to give that kind of effect. Now this she noticed a little bit of change in her jowls, a little bit of change in her neck, but didn't want a full facelift and didn't need a full facelift. So shorter incisions to do that. I don't want to bore you. I'm trying to give you the idea of the difference between, and I'm going to show you some people who needed and wanted longer incisions because they had more skin, etc. So here's a gal who just kind of wanted a pick-me-up operation because she had some important events, just didn't want so much sagging, so we go from there to there. Here's a gal who had some early changes in her neck. She didn't want a whole neck lift, didn't need it anyway, to go from there. Now here's a gal who needed some fat removal and some soft tissue repositioning, a little bit longer incision to give us that result. See the incisions, healing scars around the ears. Okay, so I hope that the idea is coming across, that custom designed approach. Some people need a long incision, some people just need a TCA peel, some people just need Botox, and it's really whatever you want. Now, I said plastic surgeons analyze the skin, analyze the face, top third, middle third, lower third. Now, when we look at the cheek and mid-face beauty, volume is so important, and we need to look at the underlying foundation, the cheekbones themselves, position and support. So a lot of the changes that occur in the mid-face we can address with volume, but we need to use all the arrows in our quilt for the mid-face. Sometimes it's soft tissue removal, reposition, filling. Sometimes we want to treat the skin. So here's a gal with very profound changes in her mid-face. So I need to address the skin. We want to look at volume. We want to tighten up and firm a little bit. And her post-op picture, I want you to see that it's almost like she's projecting more. Remember I talked about lift and fill as opposed to just stretching? So we go from there. Go from there to there. Now, when we talk about the lateral brow, cheekbone, and mid-face, that's the arc of beauty. This area here, I think, is so important in all ethnicities for men and women. We love those high cheekbones and a well-defined brow, and that's what I call the arc of beauty. So I can get to that area different ways, sometimes with a mini incision in the temple, sometimes around the ears, sometimes actually I'll get to that area through an upper eyelid incision. If I'm doing an upper eyelid tuck like a blepharoplasty, I'll slip in under the brow, etc. So here's a gal who certainly doesn't need a big full facelift, but she got a mini lift and some volume restoration to her cheekbones to give a more refreshed, vibrant appearance. So we look at the cheek and mid-face beauty. We need to look at volume, foundation, adjacent structures. Should we lift? Should we reposition? Again, so here's a gal, another woman. You can picture her with a little bit of air out of the balloon, right? So we need to look at the skin. We need to do some filling, and we need to do some repositioning to there. And here's a gal. Now, this is a little more aggressive, right? A little more skin, so the incisions get longer. I don't make long incisions for everybody, and I don't make short incisions for everybody. Custom designed approach. That's what this practice is about. Consultation, do the Vectra, computer analysis, talk to my wonderful staff, see the esthetician, sit with me, we'll look in a mirror together, I want to hear what you want, etc. So we can go from there, and a post-op picture, again, think of lift and fill. That's what we want as a youthful projecting face.
Wow.
Okay?
May I ask one question?
Please.
The picture that you used,
Yes.
how did you get rid of the brow lines that she has that were quite deep?
Okay, so the forehead lines can be treated with Botox if they're not too bad, and if someone is willing to have like a temporary treatment, Botox lasts 5-ish months. Or surgically, semi-permanent treatment, we go in with a little endoscope or through mini incisions in the scalp and fiber optic and magnification, and we can loosen those muscles, strip them, affect them that way. So before I leave the mid-face, I just want to mention malar edema. Some women in the morning and some men will notice that their mid-face is kind of swollen, they kind of collect fluid, and they come in and they say to me they want an operation to take care of that. That should be treated non-surgically to start. Head elevation and cold packs, etc. So I don't want everybody to think that everything can be treated with surgery. Of course, there's PCA peels, Botox, collagen, surgery, etc. Okay, so let's go down to the lower third of the face, neck and jowls. The natural neck lift. Some of you have heard about this. It's a system of careful analysis evaluating appearance, anatomy, and goals with a custom designed approach. The neck is one of those areas where everybody gets a different treatment based on what they present with, what they want. Do you want something done in the office, etc., etc. We need to look at the skin, subcutaneous tissue, the fascia. Fascia is the connective tissue lining on top of muscle. We need to look at the muscle, and we need to look at the bone. We need to look at the chin and jaw. So we go through step by step. Now, as you know, there is fat in the neck. There is a major muscle that I'll talk about called the platysma. Sometimes the fat is superficial under the skin, superficial to that platysma. Sometimes it's deep to the platysma. Custom designed approach. So what about liposuction of the chin and neck area? I do this frequently in the office. We make a little mini incision in the crease under the chin. About 90% of Americans that I meet already have a scar there anyway, because your little brother pushed you on the curb, or you fell on your bike, or you tripped on the stairs, or you're fighting with your sister. And then I make one little mini incision where the earlobe meets the cheek on each side. And then I honeycomb with I call it micro liposculpture, small cannulas, and vacuum and mold and shape and tailor. It's something that I do. It's manual, it's hands-on, it's handmade. It's not putting in a heat probe or laser probe, putting on a switch and leaving the room and coming back in 20 minutes. It's handmade. So liposuction actually has a long history. I'm not going to go through this, but the first person to do this that we're aware of was a gynecologist in France who used actually sharp uterine curettes. Now I like blunt cannulas with small holes. What we do is aim for that subcutaneous fatty layer. We want to leave the vessels alone. It's a manual, hands-on operation that I do, micro liposculpture, to bring the skin closer to the muscle. We're creating these channels to bring the skin closer to the muscle. I like a super wet technique. So in the office, what do? So someone comes in and they take the oral sedation and a narcotic. This is pills, oral narcotic, and usually an antibiotic and something like a Benadryl. And we let that take effect. Then I numb up the skin, right? One there, one there, one there. 3 shots, and they sting. It's a needle. Then we let that skin get numb. Then I put in this solution called Hunsted's formula. It's very, very dilute, local, with a little epinephrine and Ringer's lactate, and it really fills up the fatty layer. And then someone is totally numb and awake and mellow and relaxed, and the vessels are constricted. And I do this in the office. Little areas like love handles, sometimes the sides of the thighs, etc. Bigger areas we do at the surgery center. If you need an overnight stay, then we arrange for that at the surgery center or the hospital. So, but for little areas like this, here's a gal who came in who wanted to improve her neck area under her chin. She has good skin, she has extra fat, her chin is reasonable, and she was treated only with liposuction. To go from there. But notice that she's in that category of a person who could be treated with that. So common areas for women are under the chin that I showed, axillary pectoral folds, waist and outer thighs. My staff won't let me use that term, saddlebags. Interesting for me, interesting, I'm going to tell you something. Submentum for men, lower flanks, but they say it's okay that I use love handles. I don't really get the difference. I'm joking. An abdomen for men. So it does work for men as well. So here's a guy who just felt he had this baby fat under the chin. So numb him up, right? Now here's a gal who knew she had a little bit of extra skin, but she wanted to do the liposuction to see if she could avoid a neck lift, and it was fine for her. Again, so I don't want to bore you, but the submental liposuction, cervical liposuction, tends to do very well for the right patient. Now, I want to show another case. Here's a guy who came in knowing he has some extra skin. And he said to me, let's give the liposuction a try. I know I have extra skin. I know you're not going to take away extra skin. And so I did that for him, and he was happy because we took some fat away. His skin retracted a little bit. But keep in mind, we've got to do proper patient selection, match up the right procedure for the right person at the right time in their life. So will liposuction work for me? We've got to look at the surrounding tissues. Here's a gal, similar. She's got a little bit of extra skin, but she said, well, I don't want a big neck lift, let's just do the liposuction and see how it goes. So for her, that was fine. Now, what about when someone has extra skin? Oftentimes to address the skin of the neck lift, of the neck, I'll make a little incision in that crease, and various incisions in behind the ear, sometimes in front of the ear, sometimes under and around. It really varies, and it's a custom designed approach, and that's something that we talk about ahead of time. So, as I told you, I asked people to bring in photos from years ago. Here she is in her 20s, here she is about 50 years later. Now, I want you to know something. Look at the skin of her neck. If I had recommended only liposuction to her, she would likely have ended up in that category of unhappiness, and we don't want that. We want as close as we can get to 100% satisfaction and happiness. So she had extra skin. So we can address the fat, but what we really need to do is address the skin. And so there she is with skin tightening and skin firming. Now here's a gal with some extra skin, a little bit of extra fat, but we've got to address the extra skin, as she can't be treated with just with liposuction. So we go to there. Now, here's a gal who has kind of a profound amount of extra skin, so we've got to address the skin. And what about the texture of the skin? TCA peel. So we're going to tighten the tissues of her neck and jowls, and we're going to do a TCA peel to go to there. Maybe you're going to get bored hearing this again. Custom designed approach, okay? Everybody's different, everybody ages differently. What we want to do is design an approach for you. Okay, so here's a gal who wanted something in the office. She's got some loose tissues, big important daughter's wedding coming up for there. Now you can tell that I didn't take this picture. This woman's husband took this picture and lent it to me. He said, yeah. So a little bit of fat, see that fatty pocket? And we have to address the skin with some incision around the ears, okay? Now, here's a gal who said to me she felt like she never really had a chin. We needed to address the deeper tissues, not so much fat, to go to there. Much more elegant, much more graceful neck. Yes?
What would determine whether you would use a CO2 laser or, what was it, the other thing you just said, a T?
He doesn't use it.
You don't use lasers,
well,
CO2 laser?
I use some lasers. CO2 laser is mostly for resurfacing with pretty severe changes. The TCA peel in my hands is really versatile, and I modify the strength depending upon the skin area, etc. But it really varies, and we're very judicious, very careful in the neck, because the neck has a relative shortage of accessory glands, pilosebaceous appendages, etc. So we need to be very careful in the neck. So that's mostly for the face. So, what about going one layer deeper? We talked about the skin. I showed you TCA peel, repositioning the skin, taking out some skin, the fat. Let's go one layer deeper. When people have a loose muscle, that's the platysma, so they need a platysmoplasty. And I usually make that incision in the crease under the chin. Sometimes I go from the sides to redrape it like a hammock. I make incisions around the ears, but what we do is need to tighten that muscle if the muscle is loose. Again, custom designed approach. If a person has a loose muscle and we're relying upon fat removal and skin tightening to hold up that muscle, it's probably going to last maybe for 6 weeks. So we really need to get to the muscle if a person needs a platysmoplasty, right? Custom designed approach. Here's a gal. It's kind of hard to tell by the photograph, but in exam, I could tell she has a loose muscle. So she needed a platysmoplasty. Here's a gal with very profound looseness or laxity of the platysma. It just ran in her family. So she gets the natural neck lift with a platysmoplasty. Okay?
Did you put on gels? Could we get her gels?
Well, people get
That's as good as-
what they want.
Oh.
No, people come in, you know, we'll sit with a mirror and I'll say, what is it that you want to change? Some people say, I don't want any change above my jaw. I just want my neck. Other people say the cheeks and the neck. Other people say just the eyelids. Other people say just the forehead. It's custom designed approach. So here's a gal who has loose tissues and loose muscle in her neck, and she needs a little bit of volume. So she gets some volume, she gets some skin treatment, and she gets some soft tissue positioning. And here it comes again. You're getting this idea. I know every customer deserves a custom designed approach. Here's a nice gal who's really very good looking, but she noticed that her neck started to sag and she kind of got that matronly look. Here she is with a natural neck lift.
How nice.
And satisfying to us both. So, what's a direct neck lift? Sometimes people come in and they say, I'm okay with a scar under my chin, I just want a simple operation right here in the office, just cut away the skin. Well, there's a name for that. It's called a direct neck lift. It's not for everybody, because not everybody wants a scar underneath. But for some people, this gal, one of them, she just wanted a straightforward operation to take away extra skin. And it can be very effective if a person is willing to have a scar underneath. Some people are, some people aren't. It's interesting that when people have lots of wrinkles, sometimes I can make the scar just blend into a wrinkle. I can pick one out and just lay it in there if that's what they want. So the reason I'm showing this, well, why am I showing this? Because I want to convey that this practice in this office, you get a custom designed approach. I'm going to sit with you and give you a mirror. You're going to meet my wonderful staff. You're going to look at your computer images, and you're going to convey what you want. It's a lot about communication. It's not the practice you can hear about on the internet where you go somewhere and you get in line and everybody gets the same thing. So, direct neck lift. All she wanted was skin addressed in the office, simple operation. Now, what about the classic traditional facelift incision? It's not that I still do this. Well, I do it when it's indicated and when we talk about it and when someone wants it done. So, it can be a longer incision, and I use parts of this, I can use all of it, I can use some of it, etc. So here's a gal who wanted her face done and her neck done. She had lots of changes, and she was willing to have a longer incision. We tend to hide it in the hair, around the ears, etc. So we go to there. Now here's a gal who also had a longer incision. She wanted her eyes done, and neck done, and face done. She didn't want to be pulled too tight, but and again, in the side view to address the neck and the cheeks with a longer incision, etc. So again, she wanted her face done, she wanted her neck done, and she really needed and wanted the longer incision. Now,
Are things cheaper when you bundle?
yes, yes they are. Okay, Candace, maybe 5 more minutes? Is that okay? Am I boring people? Getting people worn out? Okay, how's the pup going? Good. We're going to stick up for the pups. Okay, so this is not just for women. Men look great with a clean, crisp neckline, of course. I ask people to bring in photographs. There's high school, there's about 10 years, not high school, there's college, there's about 10 years later, there's about 40 years later. So address the neck and around the eyes. It just gives people a much more vibrant, even for men. Men with a clean, crisp neckline.
What did he have done on his eyes?
Okay, so I'll get to that. For men, I treat for the face and eyes very conservatively in general, because men don't tolerate lots of change, except in the neck. Men need and want a clean, crisp neckline. But around the eyes, it's blepharoplasty, very conservative lateral brow elevation. And to go from there to there, it's just a much more vibrant, handsome, virile look. Now here's a guy who has a lot of fat. We address the fat, a little bit of skin, etc. Now here's a guy who came in and said he wanted a wattlectomy. He just wanted the skin of that addressed. Now here's a guy who wanted a little bit of change in his face, also in his neck, a little bit of volume, just a more refreshed look. Here's a guy who said, somebody asked me about the jowls. This guy was interesting and he said, I don't want any change above my jaw, only the neck. Just take care of a little bit, some of that skin. Same type of deal, same type of deal. Here's a guy with kind of profound laxity in the skin of his neck. after losing weight, and we get to there. So for men, clean, crisp neckline. Now, I do want to show you a few cases of the foundation. Now, the triangle, the pyramid, skin, volume, soft tissue position and amount, and underneath is the foundation. Sometimes we advance the chin, sometimes a chin implant, sometimes I bring that forward, sometimes we want higher cheekbones, sometimes we want to address the nose, sometimes the ears, etc. So, just a few cases because I think people maybe are ready for some more beverages and treats. So, here's a guy with good skin, he's really smart, hardworking, has a good job, and he felt like he never really had a chin or jaw or neck. So what did I do for him? I did a 3-incision liposuction, then I went inside the lower lip to the chin and brought that forward. So there he is about 6 months
Ah,
later.
beautiful.
And for him, he just felt like he was on top of the world. Now he just walked around, the first time in his life he had a chin and a jaw and a neck.
So just an implant then?
No, I brought his chin forward. There's different, like all these other things, there are lots of different ways we get there. Custom designed approach. So here's a gal who really wanted to bring her chin forward. She wanted her neck lifted and made crisper and cleaner. To go from there. Here's a gal who felt so matronly. She felt she never really had a chin or neckline or jawline. There she is in the early healing period. And here's a gal, same type of thing. So we go from there to there. Here's a woman who wanted, a really good looking woman. She wanted kind of an aggressive rhinoplasty, nose reshaping. I said, well, why don't we look at your chin and neck and do a conservative reshaping of your nose to go to there. So symmetry, balance, harmony. And I think at this point, why don't we thank everybody for their attention. I could go on and on with lids, but I think that we'll do that another night. Okay? So.